cover these. So how will an assessor consider what support is required? Will the participant be able to provide their own evidence as part of this process? Will the assessors have any special training and/or qualifications? And how are the needs assessments completed in remote communities?
I might start on that one, Sarah. And these are all great questions, and some of them we need to work through with the community in relation to co-design. So will the participant be able to provide their own evidence as part of this process? Absolutely. Will the assessors have any special training? We believe that assessors will require special training in the application of the assessment. How are needs assessments completed in remote communities? We will need to talk to remote communities about what is a culturally safe and appropriate way of approaching the needs assessment process for First Nations communities, and to make sure that there's coverage by needs assessors, so that other people living very remotely are able to access the service. So at the moment, this is still very much in development. We don't yet have the needs assessment tool. That will need to be developed, and the program of who delivers it is also something that will have to be worked through with the disability community. So I think there will be many questions. I have many questions myself, but the answer to lots of this is that we're going to have to work it out as we go, in close consultation with the people who will be affected by the assessment process.
Sarah, I'm just wondering whether I might just... sorry, Julie, I thought you might have finished. Maybe I could just jump in for a moment, Sarah. I mean, this was obviously an area of enormous focus in the consultations we did as part of the review. Clearly, these assessors will need to be trained very thoroughly and qualified in order to use the assessment tools. And I want to be clear, I think it is most unlikely that there will be a single tool. When you think of all of the differences in people with disability who are eligible for the scheme, I think it's, this is about a series of tools and processes. What's important is to make sure that those processes are comprehensive and are fair and are valid for NDIS purposes, and that the assessors have enough time to properly understand the particular support needs of participants, their environment in which they live, because that affects support needs, so as to come up with a fair budget for all participants. One of the things that we heard repeatedly during the review was that there are many, many instances where you've got two people with exactly the same support needs, but vastly different budgets. And so that's not fair. And what we want is a transparent process that's also fair. So what we're talking about here is very, very different to what was proposed under independent assessments. This is a completely different process. It's going to be transparent, it's going to be fair, and the assessors are going to have enough time to meet with the participant to fully understand their support needs.
Great. Thank you so much, Bruce, and thank you so much, Julie, for providing lots of clarification around the information of assessors. As we know, the key theme moving forward is there's still a lot of work to be done with the community in order to bring these to light. So thank you both. Thank you to everybody who are also popping all of your questions into the tool, and thank you to our DSS team who are in the background collating and bringing these forward for us. So our next question is for James. James, can you provide more information on early intervention? Will there be stated supports, and if so, what will these be?
Thanks. Very good question. So I think it's been touched on earlier in reference to the changes in the bill that go to the early intervention pathway. These elements are still subject to design and engagement with the disability community and other stakeholders. So there's still lots of work to be done in and around the early intervention pathway, both for children or for people with psychosocial disability or other impairments and disabilities in the scheme. Very much the focus of the bill here is to provide the general architecture and enabling legislation for rules to be created to enable that pathway to be developed. So there's much more work to be done in and around how that will be designed and to what extent the early intervention pathway would apply to different groups, as Julie mentioned earlier, in regard to people in the scheme with psychosocial disability. There's still decisions for government around and working with the agency around how a pathway might be designed more specifically, as we've recommended it by the review for people with psychosocial disability. And we've already commenced consultation with stakeholders around that area. But the broad point would be that the mechanisms in the bill that now give the consideration of a flexible budget at a whole person level and the other considerations of stated supports would need to be designed in terms of what that particular early intervention pathway would be. So the concept of stated supports for those types of areas that currently are in place in the agency in terms of their decision making, such as capital equipment, home modifications, one-off items, all of those types of activities will still be stated supports. And the question of how the broader budget setting approach would be configured for other groups in the scheme that are part of that early intervention pathway would need to be designed, and we're very much keen to get the views of people with disability and other stakeholders around that process. But largely the bill is providing the architecture around how those rules might be created that would be put in place over time as part of that longer term transitional set of arrangements that we talked about earlier. Thanks,
Great.
Sarah.
Thank you so much, James.
Sarah, I might just jump in again. I mean, I guess just to sort of just say a little bit about the way the review thought about this, but noting that all of this is subject to really deep engagement with the disability community. I mean, for children, some children need very expensive equipment, wheelchairs, assistive communication devices, those sorts of things. And I guess the way we thought about it in the review was that they would be what now is being talked about as stated supports. But early intervention itself needs to be flexible as kids' needs change, as an important example. So, the whole idea of early intervention is that it is tailored to the individual needs and that it is, working with the participant, or in the case of children, with the child and the family, to optimise lifetime outcomes.
Great. Thank you so much, Bruce. So following on from James, how will states and territories and the disability community be involved as we go forward?